From tweens to teens to adults, acne can be frustrating, embarrassing, and cause both physical and emotional scars. But a new FDA-approved laser treatment called Aramis is helping to restore self-esteem and, most importantly, healthy skin. Dr. Charles Crutchfield is one of the nation's leading experts on acne treatment and skincare, and Heather Karsikis is one of his many patients. Heather, doctor, thank you for joining us this morning. We appreciate it.
Thanks for having us.
You know, this is a really, really big deal. You know, teenagers, you think of teenagers right away, and then of course there's the adult acne that comes upon just out of nowhere. That's why, of course, they've come up with the medications and whatnot, but there's so many different viewpoints on using the medications. So this is just, when you see patients, do you see that not only do they have physical scars, but emotionally they're having a hard time as well?
Absolutely. And a lot of times when you treat somebody successfully with acne, you can see their whole life turn around. It makes a huge difference to them.
Yeah, we're going to see some before and afters, and then maybe you know someone that has this. Let's start out by talking about Aramis.
Sure.
There's not too many in the state just yet. It's a French company.
Correct.
But it is FDA approved,
Absolutely.
and that's the first one. And we're going to look at the procedure and tell me what it does actually to the glands.
Yes, it's a laser treatment. So it's a single wavelength of light that interacts with the oil glands in the skin, and it causes them to not be as active. Acne is really composed of three things: over oil production, bacterial involvement, and clogged pores. And so oftentimes acne treatments are based on one of these three processes. Also genetics come into play. But it's a laser that causes a diminishing oil production in the skin.
Okay, and so when you see patients, how many treatments does it typically take to help?
When I look at a patient, everyone is so different. And oftentimes I'll put together a combination of different small things to add up to make a major effect in the treatment of their acne. But when we involve the Aramis laser, we're looking at 4 to 8 treatments about every 2 weeks. So it's probably a 2 to 4 month program on average.
And the treatments cost $95 a piece?
Yep. Because it's FDA approved, some insurances with submissions are covering it, and if they're not covering it, patients pay $95.
Yeah, that's right. We just read about that. When did it become approved?
It was approved a little over a year ago, probably about a year and a half ago.
So it's pretty new.
Yes.
So, and do you think, are you getting results quickly from that?
No, not quickly. It usually takes 2 or 3 treatments to start to see an effect, but when it really kicks in, it makes a huge difference. The other thing it does is it treats acne, but it also reduces oil production. So a lot of my patients say they've got a double problem. They've got acne, but their skin is really oily. They say that they have to blot their skin several times a day, and it almost eliminates that, so they're thrilled about that too.
Heather, you had it done, and did you have a large problem or a minor problem?
Before the Aramis, I have very oily skin. So after I had the Aramis done, it was like throughout the day when you get more oily, I noticed that my skin was still nice and, you know, like a matte finish.
Okay.
So it was very nice.
And did it hurt?
No, no. In fact, it's actually kind of relaxing because it's like a, I don't know what it is, like a metal tip that is, it's cool, and it's cool to the touch, so it feels really good on your skin.
And did you have a little redness afterwards? Was that the only side effect that you noticed?
Not really.
Okay.
No.
And it's obviously clean. You're beautiful. No scars or anything else.
Thank you.
That's not the case for a lot of people. A lot of people do have a major problem with this, and so we have some before and afters. These are all patients of yours?
These are all patients. I took the pictures, and I think we might even have some before pictures with Heather too.
Okay. So here's one of your patients, and it was all over her face. And so how many treatments did this take to help this gal?
Usually in a case like this, a typical treatment, I'd use 8 to 12 sessions.
Okay.
But she also had combination therapy, so I used a few other things, but Aramis is one of the components we use in cases like this.
Wow, well, that's a huge improvement. Okay. And here another, this is an older gal, that's not so that's some adult acne here?
Yeah. Also, what's really nice is you can use it in all different skin hues. So if you're African American, if you're a person of color, the nice thing, it doesn't cause color changes in the skin, either lightening or darkening of the skin, and so with her it turned out very nice.
I didn't mean she was older, I just meant she was older than the first before and
absolutely.
after. Okay, and this patient?
Yes, this is a severe nodular cystic acne case, and once again you have different skin hues, and it's part of an overall program. In something like this, it would not be a standalone. I would not use this by itself to treat.
And I did read that you said that some patients, when they come in, if they have open sores, like if they've had, it'll take a while for you to be able to treat that because you can't treat the open sores.
No, we usually treat around it until that starts to resolve, and then we can treat the entire face.
Okay. Well, Dr. Crutchfield, thank you for coming in. We do appreciate you're one of the only ones in the state. There's only a few in the state that are using Aramis. And Heather, thank you for coming in as well, and thanks for sharing your story. Congratulations. Well, we want to let you know that Crutchfield Dermatology is located in Eagan, and for more information, you can give them a call, 651-209-3600, or visit crutchfielddermatology.com. Carol 11 News Saturday. We'll be back right after the break.